14 for a shooting at Century Theaters. They're saying somebody's shooting in the auditorium.
Roger, keep your fires west of the smoke. You're cleared hot. An officer hit. Send me the world.
Don't go over that fence. Don't go over that fence. Grab the shotgun again.
Welcome to Tactical Tangents.
Welcome back to Tactical Tangents. This is Mike. This episode is brought to you by Palm Industries. I have maintained for a long time that pepper spray is a way underused tool in law enforcement, and I get it. When you have to arrest someone, you do not want to have to get that stuff on you. But in personal defense or concealed carry scenarios, you want to create standoff and increase the distance, not go hands-on. I can tell you hundreds of stories about confrontations I have been involved with in real life that were resolved with some form of less lethal long before a gun would have been an option. Why not carry some in your pocket? Palm pepper spray is small, easy to carry, and it's effective. If you need something in between harsh words and a gun, this is a $12 solution. It's available on Amazon, makes a great gift. Go check them out at palmpepperspray.com. That's palm, P-O-M, pepperspray.com.
And this is Jim. This episode is also brought to you by ManusX. We've talked a lot about the tactical fantasy on this podcast, and one of the quickest ways to break your tactical fantasies and actually improve your performance is by getting real feedback. One of the ways you can do that is with ManusX. You're not going to get better at shooting on your own. You need practice, data, and coaching. And you need to make the most of your ammo with good live and dry fire training. Manus is a family of training devices that tracks you while you train. It times and tracks everything you do in a drill and coaches you as you go. It is indispensable to taking your shooting to the next level. Go find them on manusx.com.
Guys, this is Mike. I'm sitting down with Dr. Paul Sargent, who just retired after 25 years in the Navy, doing psychiatry and flight medicine, and you're a sleep specialist, right? Is that how does the terminology work there in terms of the area of expertise?
Yeah, I work as a sleep specialist in my now civilian life, but really, general psychiatrist as well. I do all sorts of things with everything from treating patients, teaching resilience, and doing assessments for the FAA, working with public safety professionals. So, maybe a jack of all trades.
Yeah, and the way this came to be actually was I attended, my employer sent me to a human performance workshop that was put on by a company called O2X, which you're working for now. And it was a kind of a fully comprehensive, full spectrum human performance. We had a dietitian there. There was a physical therapist there. A mental health expert was there. We had all kinds of really good presentations from these no kidding experts that can actually dive into this stuff. It wasn't another cop or firefighter that was giving us this stuff. It was actually from the people who know most about this sort of thing. And it was really interesting. And Paul was there to give us a very good and compelling presentation on sleep. And it was something that immediately I was like, man, we need to hear more of this. And at my work in particular, we have taken a lot of the things that we learned in his class specifically and started to make adjustments in our culture to make sleep a bigger priority for a lot of reasons, which we'll get into tonight. Paul, can you talk a little bit about your work with O2X and kind of what your guys' mission and purpose is there?
Yeah. I've been working as a specialist for O2X since about 2015, 2016. So 8 years now. And really enjoyed the process, of working with our public safety professionals. Working with the military is one thing. And typically we're going outside the country to do things in the environment around the country that keep us safe on a global scale. It's really important work. But our first responders and our public safety professionals are doing things inside our country to help keep us safe, to help manage problems before they get out of control. And if we don't do something to help maintain the health of our public safety professionals, well, that's going to cause big problems inside our country. So this is really a passion project for me. I think O2X does a phenomenal job of integrating all of these different pieces together and providing really excellent training. And I'm just happy to be kind of a small part of it. But I do think that while I'm a small part when it comes to recovery and sustainment and performance issues, sleep actually is a really big part.
Yeah, it's huge. And that's exactly what we're going to obviously dive into. Now, your O2X as a company has a heritage, as I understand it, mostly like a Navy SEAL special warfare type of background, like the guys that started it. And you spent a good portion of your career working with naval special warfare guys in all kinds of environments. In fact, I think there was a tidbit that I remember from your class that you said was at one point you were like the only psychiatrist in Iraq or a portion of Iraq that you were at some point, something like that.
Yeah, I was in Anbar Province in 2009. and really not with special operations at that point at all. I was working with the Marine Corps, and I was the psychiatrist in Anbar Province, and we were based out of Alticatum, and that's really where I started to get interested in sleep issues, because I was seeing so much insomnia and problems with sleep in our Marines and soldiers who were there. The special operations work came a bit later.
Yeah, which is probably interesting in its own self. But that you actually led me into the other question I had, which was how you got interested in the sleep thing. And that was one thing you mentioned during that time in Iraq. People would come to you and need help with sleep, and your requirement before you would medicate them was you got to come to this class.
Yeah. We would see people who were being deployed, and different service branches have different deployability criteria. So you might find somebody who's deployable under Army criteria who wouldn't necessarily be deployable under Navy criteria. So I'd see people who were coming in with quite a few medications that they were bringing with them. And obviously this is a potentially kinetic environment. Everybody's carrying a firearm, and there's, potential for conflict. And so what we want to make sure is that if I'm treating somebody for a sleep issue using a medication which, might dull their sensorium, we don't want to overdo that. We really want to try to minimize that for somebody who's, in an environment where, they're armed and have to be on alert and providing very safe operating conditions for themselves and for everybody else around them. So people would come in, they'd be prescribed a variety of medications. But for me, I really wanted to start to teach people the skills they could use to reduce the medication use as much as possible. So we put together a program called Combat Sleep School, and that actually got written up. It's out on the internet. So if somebody wants to look up Combat Sleep School, they can kind of find some information about that. But it was based on cognitive behavioral therapy for insomnia. So an evidence-based protocol. It's not something that I invented on my own, but really something I tried to apply there with fair degree of rigorousness and methodology to make sure that people were getting access to good evidence-based care, aside from just throwing more medications at them in order to get them to sleep.
And that's in terms of mindset for anyone listening. Two things come to mind that we talked about before we started recording. And one was people tend to be focused on solutions. They want some medication to throw at a problem. And really what we need to do is dive into and examine the problem itself, which also led us to a conversation about there's a little bit of a difference between wellness and illness. And we focus so much sometimes on the illness side of it and getting the treatment, which is important and certainly has its place. But also there's a lot of things that you can do to tackle the problem on the wellness side of things, where maybe you prevent some of these things from coming. And I think as it relates to what you've taught me about sleep, I think I've always cognitively accepted that sleep is important. You gotta get your sleep. Like, that's a big deal. Sure. But putting that into practice sometimes is easier said than done. So you need some strategies to be like, well, maybe every day I'm not going to get a perfect 8 hours of sleep or whatever. And then the other side of it is, yeah, we know it's important. We accept that, but like, how important? And putting the weight into that is a big deal. So just as an introduction to that, can you just talk about generally what happens when we sleep and why is it so important?
Yeah, thanks. It does have to be a priority, Mike. It's not something that just happens on accident, And I think what I really like to do when I talk about this with people is frame it in the concept of circadian entrainment, right? And that you're not just talking about sleep only during a dark phase or a night phase. If you really want to have good sleep performance, it's really a process of circadian entrainment and waking up all the way when it's time to be awake. I think it's pretty easy for people to understand that this sleep-wake cycle kind of looks like a sine wave, right? And that if you're not sleeping well down on the low part of the wave form, right, you're probably not going to perform well the next day, when it's time to get up. But the opposite is also true. If people don't get up, get bright light exposure, get activated, get going during the day, use the energy that they have, what are the odds that they're going to sleep well that night? And the answer is not good. Right. So what I really want to do is coach people on this area of circadian entrainment first and foremost to at least get these patterns right. Because without that, if you don't have that foundation, the rest of it starts to really fall apart. And I know it's hard for first responder and public safety professionals because you're working odd shifts. Right. In our modern society, somebody has to be up 24 hours to keep an eye on things. But human beings aren't really designed to operate that way. Physiologically, we have not changed in the last 40, 50,000 years, right? We are still these organisms that are designed to wake up in the morning, function during the day, and recover at night. That's how we're designed to operate. And so I really encourage people to start off, if they really are having problems sleeping, to start thinking about how do we fix that first thing in the morning when you wake up. It's that bright light exposure. If you're heading into work and you don't have to wear sunglasses, take them off. Get some light exposure in your eyes, right? If you're wearing a baseball cap and that's shading your eyes, get that off. Get at least 15, 20, 30 minutes of bright light exposure before you get into the office. People think that once they're in the office, they're getting enough light. They've got incandescent bulbs or fluorescent bulbs. But again, if you actually have a light meter in the room and start measuring it, you're not really getting that much photic stimulation to wake you all the way up. So this is really important, because once you trigger the optic nerve and the signal through the hypothalamus to actually wake all the way up, it's going to set your rhythm so that 16 hours later or so, your body's actually ready to go to sleep.
Yeah, that's and correct me if I get this wrong, but one of the things you talked about in your class in terms of getting daylight and measuring it was you might not perceive that you might be in a room that's fluorescent lighting and seems bright, but your pupils are adjusting the amount of light to be whatever's optimal for your vision. But that's not the same thing as the exposure that you're getting outside in the sun, right?
Right, exactly. Yeah, you really need to be getting bright light exposure. And so for some people, if they're trying to get on a good circadian rhythm and they're finding there are logistical problems with them getting the light stimulation that they need, right? They have a work environment they really aren't able to get near a window or get outside. They may be working in a secure facility or something like that. Or they may be at a latitude, right, where, in the wintertime, the sun doesn't come up until really they're kind of in the office already. So in those cases, you might even want to think about investing in a light box, a 10,000 lux light box, which you can buy on Amazon or any other store, Best Buy. I won't just promote Amazon here, yeah. but you can buy a light box, and they're very small. It's about the size of a tablet computer, and you can put it right next to your desk and give yourself some of that light stimulation while you're working, so that you're not just in dim light all day. And that's a great fatigue management tool as well.
And fatigue management is definitely something I want to come back to, because they're obviously connected. And I think the key thing that you talked about was in terms of the rhythm, waking up all the way and being awake for your best during those hours and getting sunlight. I mean, those are all things that I've tried to make a point of doing. I go to the gym and I work out, but I need to make sure that I'm also getting outside to get daylight, whether that's taking the dog for a walk or whatever. Particularly hard being a guy that works night shifts almost perpetually, right?
Yeah, and if you're working night shifts, you're being exposed to light quite frequently. You're on a screen, you're doing something that's shining light into your eyes at a time when physiologically your body's not really designed to be getting a lot of light. So, if you're wearing sunglasses all day long or inside all day long and your brain doesn't know exactly what time it is, and then you're shining light in your eyes all evening or night, your brain still doesn't know what time it is. Yeah. And so your body really starts to get desynchronized as far as understanding, should I be on a wake cycle? Should I be on a sleep cycle? What should I be doing? And when it's time to go to bed, lo and behold, the body doesn't seem to want to cooperate.
It's very interesting. So what kind of things happen when we don't get enough sleep? We'll talk about the wake and the fatigue management side of it, but
yeah, sleep deprivation is, I think going to be one of those things that we look back at as almost like the black lung disease of our current time. We now have technology that can stimulate us 24/7. If I look at a 50-inch flat screen TV on the wall that somebody can use to, keep themselves entertained all night. And actually the shows and the programming that comes through that are literally designed to rope us in and kind of be addicting in a way, right? Yeah. Where you watch an episode and you think you might be done after this episode, but then there's that cliffhanger and you want to watch 5 minets of the next episode, and all of a sudden you're back into it again. So
binge watching.
Yeah, absolutely. And so the things that are around us are designed to capture our attention. Our attention is now being bought and sold. It's currency. It's valuable. Right. And so people want to get attention and compete against our sleep to keep us interested. So sleep deprivation becomes something that we're all dealing with all the time. Right. None of us is going to get perfect sleep every single night. And so we have to be prepared for sleep deprivation. And it's going to cause issues with hormonal balance for both men and women. It's going to cause problems with attentional control. It's going to cause problems with even physiologic function. You may think of like when you go to sleep, your brain goes to sleep, but actually your whole body goes into a rest and recovery cycle. So we're seeing when people are sleep deprived, they're more likely to have accidents, trip, fall, poor coordination, emotional outbursts, all sorts of different problems that happen when we're sleep deprived. And anybody who's raised kids kind of sees that too, right? When you know your kid needs a nap, you see it, and you see all the problems that go into that. And sometimes we're not the best at self-assessing for ourselves how sleep deprived we are. And so I think that sleep deprivation, especially for people in public safety professions, is definitely a occupational hazard, that we really have to pay attention to. If you were going onto an op with somebody, going onto, a crime scene, right? Would you really want your partner to be sleep deprived? Is that really a safe thing for you or for them? What's the likelihood that a mishap occurs or some mistake gets made that winds up, being regretted later?
Yeah. And that's the thing is, it's hard to measure, right? How bad it can be. Cause there's times where we go op to op to op and it's like, all right, who can stay for the next one? And like, who's going to be the guy that says, not me, and you're like, all right, here we are. And it's hour 18 or whatever.
Yeah. Well, and if you think back just to the last year, for you or for anybody who's listening, right, over the last year, how many times can you identify either a mishap or a near miss that was associated with fatigue when you look back?
Yeah.
Right. It's pretty common. Or in our home life, right, an altercation or a disagreement or a poor decision that was made because I was overtired. And I really wish I had a do-over on that one.
So I want to dive into some of the things that you talked about. You mentioned hormonal changes. You mentioned the inattention thing, which I have a follow-up question on the cognitive stuff, and then like long-term health effects as well. But starting with the hormonal imbalances and the implications of not getting enough sleep, I know that was one of the things that was an attention getter, especially for the guys in the room. But I know you have a balanced approach there. Can you talk a little bit about that?
Yeah, sure. I mean, when I do this with my service members, what I like to say is when I have them by the testosterone, I have their attention. And so what we would see on active duty is, sometimes I'll have folks come into my office and they'll meet really all the criteria for depression. They'll be, sad and uninterested and feeling bad about themselves, difficulty focusing, changes in their body habitus, or they may be putting on weight, decreased sex drive, and they just look for all the world like, this looks like depression, But you start taking a history, you start gathering information, and you start to find out like, this person isn't sleeping very well. They may have some changes in their sexual performance or things like that. And you get enough information, you start to go, maybe there is something else here, and I want to draw some labs. I want to understand, make sure I'm not missing something, right? So as a mental health professional, it's not just about taking the history, but we're also going to make sure that biologically we're not missing something. Could this person be having a thyroid issue that's contributing to their depression? Could they have a substance use disorder that is impacting them? Could they have something like a vitamin D deficiency or even a low testosterone level? And so I would say when I drew a lab on these 25, 30-year-old Marines, it was not uncommon for me to find a borderline low testosterone level in a young person like that, young man. It may, even if it's not clinically past the low, cutoff threshold, it's certainly lower than you might expect for a 25-year-old young Marine who is otherwise fit. So you start taking the history and you find out, this person really hasn't been sleeping. And so when I can talk to them, I start to find out why. What's going on where you're not sleeping? Well, I live in a barracks. It's kind of boring. There's nothing to do. So what do? Well, we play Call of Duty all night. They're up till 2 o'clock in the morning, playing video games.
Sounds about right.
Yeah. Or they might be, up late drinking. Hopefully they're over 21, or engaging in any other sorts of behaviors that are going to prevent them from getting the rest that they need. Once I can start to show them these numbers and how the sleep deprivation is affecting their testosterone levels, now I have a tool that I can use to teach. Now I can start to get the behavior change to occur that can cause them to prioritize sleep and actually start to get more, right? So, the idea is if you're picking up that Xbox controller, do you realize that you're kind of castrating yourself, right? Every time you pick that up and it's after 10 p.m.
One way to say it.
Yeah, maybe we want to kind of put that down and use that time more wisely to actually rest and recover. So we see folks come in with these levels and people say, well, if you're detecting low testosterone, you're going to send them to the endocrinologist and ask them to get put on testosterone. And the answer is no. It's a teaching opportunity, really, because so much of the stuff comes down to behavior and making the right choices to maintain our health.
And so where in sleep does that testosterone production occur? Because I know in my notes I had some pictures of graphs and all that stuff, and obviously we're describing this in an audio format, but what are the implications for someone who's trying to tackle sleep and maybe feeling those symptoms?
Yeah, I think that's a great question. So when you look at sleep, it's not a monolithic event. People don't just fall unconscious, spend 6 or 8 hours unconscious, and then all of a sudden wake up. Your brain is kind of running a little computer program during that whole time, which is all about recovery and restoration. So in the early parts of sleep, you're going to see a lot more deep, slow wave sleep, and that's going to be associated with growth hormone secretion. And it allows your body to heal and recover from the things it was exposed to that day. Very important for healing and for musculoskeletal recovery to have growth hormone. The latter half of sleep is actually when you're secreting, when you're getting more REM sleep, rapid eye movement sleep, and that's the time when you're going to be secreting testosterone. So again, if you're cutting your sleep off short, you're only getting 6 hours or 5 hours. Well, you're missing out on this whole back end, and you're missing out on that dense REM rich sleep. And that could be a reason why some of those hormones are falling off. So the sleep is really different depending on what phase of the sleep that you're in. And you really need all of it, right? I think some people feel like, oh, you need the deep sleep, or oh, you need the REM sleep. You need all of it. But you're not going to get all of it unless you're getting that consistent 7 to 9 hours.
And I want to talk about the phases a little bit in terms of, because I was actually able to see some of this in the charts that you presented in the class, and then what my Garmin told me that I get when I actually sleep. Can you talk about these graphs and what I should be looking for in terms of?
Yeah, well, tell me what your Garmin. What'd your Garmin show you?
Well, it shows the graph is called a hypnogram. Mm-hmm. Is that right?
Yeah.
And in the first half or so of the sleep is where all the deep sleep tends to be condensed, yep. Mm-hmm. And then the REM sleep tends to be more in that back end. And so what I'm just wondering for an end user, like it looked like the chart, mm-hmm. Side by side, but what does that mean to me? Like, what am I doing right or wrong, or should I be setting targets for ratios or something like that? I mean,
yeah, no, that's a good question, because I think you can, in the Navy, we call this nuking something. You don't want to nuke it, right? Which would be like, paying so much attention to it that you overdo it. What you really want to see are a healthy balance of REM sleep, which might be, in an 8-hour sleep phase, you might get hour and a half or 2 hours of slow wave sleep in that 8-hour cycle, and you might get about the same amount of REM sleep. You want to see both of those represented in there, but there's no magic number. Right. And what you're going to notice is as you sleep, you're going to get different percentages every single night. So if you're really trying to chase a number there, I think you're going to wind up, kind of stressing yourself out over it and making the whole process not relaxing. Right. So I think it's useful. I also think that the wearable technology is good, but it's not a replacement for the scientific, medical grade technology. So if people want to use like an Apple Watch or an iPhone or a Garmin, or innumerable different technologies that are out there, I say do it by all means. Gather the data. It's good. It's useful, but it's not medical grade technology, and so shouldn't be confused with that. It might tell you that there's kind of a general issue somewhere, but you should be working with your medical providers to really explore those issues if you have a concern. I think that another one is like an O2 sensor that people have on their Apple Watches. I'm not sure if Garmin has that also.
They do, yep.
And that's useful data to look at. We see people, are not uncommonly diagnosed with sleep apnea. As we age, the numbers of people with sleep apnea go up. We see that in the military. You see that in law enforcement. That's oftentimes associated with changes in our body habitus and our body shape as we age as well. But that O2 sensor on my Apple Watch is useful data. It's interesting, but I don't necessarily assume that it's always 100% accurate. Will I look at it? Yeah. And if I'm, staying above the 90s pretty much every night, great. I'm not going to necessarily go get a sleep study. I may snore sometimes, but I feel okay. Now, that said, what do I do if it repeatedly is giving me data that says, hey, you're dipping down below 90 quite frequently, I'm not going to ignore that. I'm going to go talk to my doctor. Or what if my data suggests, hey, you seems like you're doing well, but I'm waking up fatigued all the time, or I'm waking up with a headache, or my bed partner says I'm snoring a lot and gasping. Even if the data is good, I'm still going to go get checked out. So it's useful, but I wouldn't overly rely on the consumer data that's available to us.
I think if nothing else, what I've taken from using the watch, because I've noticed, like, let's say I have some drinks the night before and I wake up the next day, hey, I noticed you had poor sleep last night. And I'm like, all right, I'm feeling judged, but my watch nailed it. It's not like my watch knew I was drinking.
No, but isn't that amazing?
Something.
It really does. Yeah. And that's one of the first indicators that people really notice, is my watch knew I was drinking. Right. And it really starts to build some buy-in to the data that people are getting off that. And I think that's okay. What I really like about this is looking at the total sleep time. Right. I think that's probably the most reliable number that you're getting off the consumer, products. If it says you're getting 6.5 hours, that's pretty accurate. If we're getting 7.5 hours, that's pretty accurate. The sleep architecture that it describes internally can be a little bit off, but the total sleep time is useful. And so, if I'm noticing that I'm more moody, or if I'm having lower energy, or if I'm having trouble getting projects done, and I go back and I check my my watch, lo and behold, I may have been getting less than 7 hours for a week or so, and at least it reminds me, like, yeah, if you want to get right, you got to prioritize this again. Right. Is 8 hours the number? Is that what we should be shooting for? Yeah, I wouldn't nuke it. Right. You're trying to get 7 to 9. 7 to 9. Okay. But the best sleep experts in the world, are going to have some nights where they probably get 5.5 or 6. Sure, that happens. I want to jump back to the testosterone hormone stuff. I know we talked a lot about the hormone implications for guys. What about for women? Yeah, that's a great question. And there's more and more data, that's more and more studies that are being done on that. And so I don't think that the relationship there is quite as well established as far as a sleep deprivation effect on hormones. But there are studies out there that are showing, or that suggest, that women who are experiencing sleep deprivation may have some menstrual irregularities that are more common for them. There may be some challenges with fertility that come from sleep deprivation, and then increased risk of some types of cancers like breast cancer and things like that. So I don't think that that's as firm of a relationship, but sleep deprivation is very important for women as well. And also sleep problems are more common for women. And that has to do with normal hormonal cycles that occur throughout the months. As estrogen declines, that's oftentimes associated with poor sleep. So that could be in that week prior to menses, or as women approach menopause. That's also a time when sleep becomes a real problem for them. And so anticipating that, and again, applying good behavioral strategies to try to mitigate that. And of course, working with your doctor, if there's something that can be treated there, it's okay to get treatment, right? If what you need is a medication to get you to sleep, that's okay, right? It's better than having terrible insomnia that can't be addressed. So I don't want anybody to kind of get the idea that it's got to be all one way or it's all the other way. Do the best you can with the behaviors, take on the best habits that you can. And if you need to take a medication, that's okay too. Right. You mentioned the risk for certain types of cancers. Is that connection also true for guys in some cases, or what other long-term health implications are there related to, we'll call it like a chronic sleep deprived state? Yeah. Well, for this rest and recovery phase is a time when your body is healing and restoring itself, right? Every piece of gear that you're using on the SWAT team has a maintenance cycle. What happens if you don't maintain your gear? Its lifespan is shortened. Right. And we see that true. SWAT guys are hard on gear. Yeah. It's just a fact. And maintenance isn't always fun, right? Like nobody likes to necessarily go and do the preventative maintenance they need to do, but that's what sleep is. And you have to attend to it if you really want to have that gear last you, right? And unfortunately, we're not just, the gear that we've been issued when we were born. we don't get to have that replaced quite so easily, right? So you really have to take care of the gear. One of the main things that I see, that I'm most interested in for people who have long-term sleep problems is the risk of dementia. And we're really seeing a strong relationship between chronic sleep problems and cognitive problems, memory problems later in life. I'm not sure how many of the listeners have experienced taking care of an aging patient that has memory issues, but that will put the fear of aging into you and will help you to really make better health choices when you see the ravages of what dementia does to people.
Yeah, absolutely.
Yeah. And so your brain is also, it needs to restore itself. And that's a time when you're sleeping that the cerebrospinal fluid actually circulates a little bit more and helps to remove some of the waste products from the metabolic activities of the brain during the day. So if you're not sleeping, you're literally not allowing your brain to remove the waste products it needs to remove from the CSF as well.
Interesting. Any other... We talked about how sleep issues can lead to low testosterone, which can mask itself as depression. What other types of long-term problems come up that have some nexus around sleep? If there are any other big ones that come to mind.
I'm trying to narrow the answer down into something that seems reasonable, but you're going to find increased rates of almost every health problem from sleep deprivation, and in the short term, we look at public safety professionals like yourself, what are the odds that after a long shift, somebody loses alertness and has a motor vehicle accident on the way home because they were sleep deprived, right? Even in the short term, we also see rates of heart attacks and cardiovascular incidents going up as a result of sleep deprivation. There's actually some association with daylight savings time, where they've seen changes in the rates of heart attacks based on moving the clock forward or back and how that affects people's sleep.
Interesting. I remember you talking about it, but you said it was something like the day that they gain an hour, like the rate went down, and the day that they lose an hour, like the rate went up or something.
That's right.
Yeah. What about the cognitive performance stuff? There's an artillery study that you talked about in your presentation, measuring combat effectiveness of Army artillery guys. Can you talk about that?
Yeah, roughly, this is referenced in a few different books. I think Dave Grossman wrote about it in On Killing, and then you can find this publication online as well. But, the Army has done a good job of studying the effects of sleep deprivation, because the question was really, if I'm a commander in the field and I can get my folks to work for a few extra hours, right, to accomplish more things, am I actually creating more work that was done over that period? Because if you're working for 18 hours versus 16 hours, you might expect that the workload, the amount of work that got done went up. What they found is that the opposite was true. Over time, when you start to do this over 3, 6, 10, 14 days, the rates actually of performance actually go down dramatically. So in the Army artillery study, what they found was that the group that was allowed to get 7 hours of sleep per night for 2 straight weeks remained 98% as effective as they were at the outset. But if you cut that to just 6 hours per night, the rate of performance gets cut in half. You cut it to 5 hours of sleep per night, it gets cut in half again. And you cut it to 4 hours of sleep per night, it gets cut in half again. Where their rate of performance, if they were getting 4 hours of sleep per night for 2 weeks, was really about 15% of what they were at baseline.
That's insane. And just thinking about going down to 50% from just 6 hours, just going from that 7 hour mark down to 6, losing that 1 hour.
We've all been there, right? You do that in police work. We do that in medical training for years, right? Where people are sleep deprived. And yet it takes a serious toll.
How can you make up for lost sleep? What's the use of napping? You talked about in your class, like a sleep debt or sleep banking, I think was the term.
Yeah. So I think, again, it comes down to being proactive. So if you know that you're going to be going into a situation where, let's say you're doing a 48-hour shift or something like that, instead of trying to figure out, well, how do I make up for the lost sleep on the back end of that? What I'd really be thinking about is sleep banking up front. How do I make sure I'm getting a little extra sleep before I go into that evolution, so I'm prepared and I'm safe, and it's going to affect me less, right? But then we also get into fatigue management strategies, right? So knowing that there are going to be times when all of us become fatigued, there are things that you can do to try to manage that. It's not a long-term thing, right? I don't want people to get into fatigue management as a way of life. But there are some strategies that people can apply to try to mitigate the fatigue in the short term, again, to be safe and to perform well. And naps are one of them. Naps are hugely beneficial, and as a routine nap, maybe less than 30 minutes, just to catch a little bit of restorative rest and perform better. But if you've been on a long shift, you might need a little bit more, right? If you've been up for 48 straight hours and you get home, don't be afraid of taking a longer nap. If that's a couple hours, take it, right? The way that you'll know if you're napping too much is then when you get to the next normal sleep phase, 9 o'clock, 10 o'clock, 11 o'clock at night, when you should be able to go to bed. If you're noticing that you're not tired, I can't sleep, this is, disrupted, the nap was probably too long or too close to bedtime, right? So that's how you kind of learn your rhythm and what's going to work for you. So much of the stuff is so individualized. People say, how do I fix my sleep? And I say, well, what's wrong with your sleep? I really have to.
It's individual.
It very much is, and so I think understanding what works for one person is not going to be the same exact thing that works for everybody. We can apply, some general rules, right? But people have to take those rules and adapt them to their own needs, right? Like, so one of the things I like to talk about is, what's the difference between knowledge and wisdom?
That's a deep question.
Yeah, knowledge tends to be information that is contextual. Within a certain context, this information really helps me in this context. Wisdom tends to be information that helps me across a variety of contexts.
More generalized.
More generalized, right? And so as we look at sleep, this is the things that we apply are really more of a wisdom-based construct. It's not necessarily putting the exact knowledge into somebody and saying, well, this is exactly what you do right now, because your life is changing, your situation's changing, your circumstances are changing. So I want to give you broad concepts that you can then start to apply in your own life, in your own specific context, and apply that wisdom, right? Part of wisdom also is self-discipline. And to apply any of these things, it takes self-discipline, which is hard when you're fatigued, right? Right? We all make worse choices when we're tired, right? If I'm sleep deprived, I'm much more likely to choose the wrong foods and eat the thing that's bad for me. I'm much more likely to have an extra glass of alcohol that I shouldn't be having. I'm more likely to stay up and binge watch that show that I know I shouldn't be binge watching. When we're tired is when we make our worst choices, right? How often do you wake up in the morning and, really have something that you look back on, you're like, yeah, I just really shouldn't have eaten that, versus at night before you go to bed.
Right. Yeah, it's usually at night for sure.
Yeah.
So you talk about how there's no one size fits all approach in terms of either, I guess, what we could call sleep hygiene or fatigue management. Can you talk a little bit about those things as far as like the trends? What types of points come up in either of those? Yeah.
Let's go back to fatigue management, because I think that kind of rabbit hole a little bit. But so naps are important. They're one fatigue management tool that's really important for people to apply. Another one is caffeine, right? Caffeine is a good fatigue management tool. But
so like 6 bangs. Throughout the course of a shift should get me through it.
No,
right?
No, definitely not. Yeah. It seems I was seeing a lot of that in Iraq as well. That was kind of the typical course, because people think that if a little bit's good, then a lot must be better, right? And so they'll kind of bolus it right up front and take a large dose of caffeine, and then what happens is it spikes up hard. And then crashes down, and then they're kind of chasing that. And it becomes less and less and less and less effective for them the more caffeine they're using. So, you want to have caffeine discipline, right? If you want to wake up in the morning, you have a full cup of coffee, go for it. Have 2 cups of coffee, fine, right? But if the strategy here is looking at fatigue management, then we're not doing coffee that way, right? We're not doing it just to wake up in the morning. The right dose for fatigue management is about 50 milligrams an hour. So if you look at a typical Starbucks, how much caffeine's in a typical Starbucks?
Probably at least 200 to 300 milligrams, if I had to guess.
About 200
depending
milligrams.
on what you order.
Right. And so if we're looking at 50 milligrams an hour, it takes a little bit of discipline, right? Like, I'm drinking a quarter of this Starbucks per hour. That's hard for people, right? Like, people don't have that. If it's hot and it's warm and it tastes good and it's in front of me, right? I'm not going to be able to make that thing last. So one of the other ways to do that is to switch, right? If you know you're doing fatigue management now, right? I've been up too long. I know I'm going to need to get to sleep at some point here, but I'm tired and I don't want to be, making mistakes. Switch to black tea. That same size cup of black tea is about 100 milligrams. Or switch to green tea. That's about 50 milligrams, right? So if you're drinking 1 cup of green tea per hour, you're now on that rationing of caffeine that's going to allow you to mitigate the fatigue, but not put you on this roller coaster ride of stimulation and crashing. That's not going to work. And it's going to be there for you when you need it, right? You're not overloading so much that then if you need a little extra to pick yourself up, it becomes ineffective, right? So naps could be good or bad depending on how you're using them. Caffeine can be good or bad depending on how you're using them. And then light, right? And again, going back to that circadian entrainment, it's a fatigue management tool. So the half-life of caffeine is about 5 hours for people, and maybe a little faster depending on their metabolism. But generally speaking, it's about 5 hours. The half-life for light isn't quite that long. There's no half-life per se, right? So if I'm looking at a fatigue management strategy for a long shift, right? If I'm going to do 48 hours, I might focus on sleep banking before my shift. And then I might use caffeine for the first half of my shift, right? At a low level. And then use light as a way to stay awake or to stimulate during the last half of my shift, knowing that I'm going to want to get some sleep at the end of that. And if I'm drinking caffeine all the way up till the end, I'm probably not going to be sleeping very well. So there are distinct tools that you can use and phase in a way that allows you to get the fatigue management that you need, but not be overly disruptive on this really important sleep-wake cycle that we need to try to maintain.
And the light exposure is better to get later in the day after the caffeine has kind of worn off, you think?
If it's a fatigue management strategy, right? So that's the
not
problem.
Not a waking up strategy necessarily.
Or if you know you need to go to sleep, you need to get the lights off a couple hours ahead of time, right? So even light, you don't want to use all the way up until you go to sleep, right? When we see people they'll get off their shift and then, they'll watch TV for 3 or 4 hours right before they go to bed. The amount of light that they're getting from that big flat screen TV is so stimulating they can't go to sleep. So it's not something that's going to be a hard and fast rule, but you want to try to use sleep banking, caffeine early, then use light, but make sure you're getting that light off a couple hours before you are really needing to go to sleep.
I think that's a good set of guidelines that people can apply pretty easily. So thanks. That's perfect. Sure. What about, there's a term that you used in your class, fragmented sleep. And this is something that I experience all the time, where I wake up and I'm tossed and turned. I can't fall back asleep.
Yeah.
How do I deal with that? What does that look like, and how do I deal with it?
Yeah, that's another good one. And it kind of comes back to this idea of what people think is good or bad, and wanting to classify things as good or bad when the answer is it depends, right? If I take this all the way back, if I say, are naps good or bad? Depends, right? Because if you're using too close to sleep, you could disrupt your sleep. If you are, is caffeine good or bad? Depends. Is light good or bad? Depends. Is fatigue good or bad?
Depends. I see where this is going.
Yeah, right.
This is a common theme on the podcast when it comes to insight and nuance, and it's not just black and white. There's some gray. And if I had to guess, I'm just going to take a not so educated guess on where you're going.
I'd rather hear you talk than me talk. Go for it.
No, but I think what this is talking about is the entrainment thing, right? Mm-hmm. Where you need to be a little bit tired to go to bed. Right. That's where you're headed with this, I think.
Yeah, exactly. And so fatigue becomes your friend in the way that you're going to treat sleep fragmentation. If you want to read about this, again, it goes back to an evidence-based protocol called cognitive behavioral therapy for insomnia. And I would encourage anybody to read about this. This is really good stuff. And you learn a whole tool set within cognitive behavioral therapy for insomnia and skills that can address a variety of situations. But sleep fragmentation in particular, one of the protocols that we use is actually sleep restriction or sleep rationing. So let's say, for example, somebody lays in bed for 8 hours, but they are up and down and fragmenting. And then over that course of that 8 hours, they only get 6 hours of actual sleep, right? And they really want to get 6 unbroken hours. That's what's really going to preserve good sleep architecture, right? To get them all the way through those slow waves and the REM cycles. They want a good unbroken period of sleep, but they can't seem to get more than 2 hours without waking up. Right. So how do we reset that? How do we convince the brain that at that 2 hour point that it thinks it needs to wake up? How do we convince it to stay asleep? Fatigue becomes the tool that we start to use. So if a person is only getting 6 hours of sleep based on the data that they're using on some sort of a tracker or watch or something like that, working with their professional right? Again, because what I don't want to do is give people, right, I don't want to give people some advice that they then take and run too far with, which people do.
Like everything on the show, this is not medical advice or legal advice or anything like that.
Yeah, exactly. But the idea is going from 8 hours in bed that are fragmented to limiting to 6 hours in bed. That's all you're sleeping anyway, right? If you look at this on a clock and you say, okay, I get up at 6 o'clock in the morning and I know I'm only going to allow myself 6 hours in bed. What time do I get in bed? Midnight. Yeah. Right? And then that first night that you do this, are you going to sleep straight through till 6 a.m.? Probably not, right? You're still going to fragment. So you're probably getting less than 6 hours that first night, but you go around again. The next night, you've only allowed yourself to be in bed from midnight to 6 a.m. You get in bed at midnight the second night. How tired are you?
Turbo tired.
Right. What are the odds that you're going to get in bed, fall asleep, and stay asleep until through that whole cycle? Better, right? And then you do it again, right? So 3 nights in a row, you've done this cycle where you're getting in bed at midnight, getting up at 6 a.m. You're tired enough that the fatigue is going to start to drive your brain to stay asleep through that 2 hour kind of milestone. Does that make sense?
Yeah, absolutely. And
then what you do is you start to build longer and longer periods into that. So it's really like a weightlifting analogy. If your max bench is, for a SWAT guy, your max bench is, 350 pounds, and you're trying to take it to 450 pounds.
Obviously.
Yeah, clearly, right? You don't just put the heavier weight on the bar. You only lift what you can lift, right? So if you're only getting 6 hours, you allow yourself 6 hours, right? And then you give yourself an extra 30 minutes. So instead of going to bed at midnight, maybe go to bed at 11:30. Do that for a couple of days. Back it off to 11. Do that for a couple of days. Go to bed at 10:30. Do that for a couple of days, right? And then within a very short period of time, less than 2 weeks usually, you'll be able to get somebody to get in bed, fall asleep, and sleep straight through till the next morning. And you've created, through neuroplasticity, a new pathway for the brain to understand it's time to stay asleep. If during this protocol you find that you're fragmenting again, you might have gone a little too fast. Right? Maybe bring the bedtime back a little shorter again. So again, I think this is a great concept, right? To understand how fatigue works and how fatigue can be our friend. But when it gets into specifics, especially for people who are, on the job and working odd schedules, 48 on, 72 off, whatever it is, I think that doing this with a professional is really important because you don't want to be putting yourself in a situation where you might be doing it wrong. Right? You're not working with any sort of coach or anything like that. You start doing it wrong and now you're just sleep deprived.
Just arbitrarily depriving yourself of sleep, right?
Right, exactly. And so I do think that working with somebody who has some experience with this is useful to get some coaching, and if you have a department psychologist or, somebody like that, maybe through the EAP program or, just work with somebody who can kind of help keep an eye on things. And I think it's also important to tell your teammates and to tell your family if you're going to do a protocol like that, because for that period of time that you're doing it, you may not be fun to be around, right? And it also might be good to have somebody kind of cross-checking you to make sure like, hey, I'm going to be a little bit fatigued while I'm doing this. Keep an eye on me and make sure I don't do anything stupid. Letting people know that you're tired is an important fatigue management strategy, because if people think you're 100%, but you're not, they're not looking over your shoulder.
You're a liability, not an asset.
Yeah,
at some point.
Yeah. And I think that we're all in this together. It's a team sport. I want to know if my teammates are 100%. I want to know if they're 80%. I'll take 80%. That's great. But I want to keep my eye out, because if I see them doing something that might be a little off, I can catch it early before it leads to a bad outcome.
Yeah, teamwork isn't about shouldering all of the weight, right? And being the 100% guy all the time. It's about doing your share of it. And we can, if we know where we're at, we can kind of work together in that sense.
Which kind of brings us around to culture too, and sleep culture, right? So, if I was to ask you, what's the culture around sleep historically for your department?
Get to work.
Yeah. So
overtime. Can you stay late? Now you don't have a choice to stay late.
Yeah. Or not prioritize, right? And so you were talking to me about, having to kind of take the bull by the horns and talk to some leadership about like, hey, maybe we can schedule our trainings at a different time that allow us to actually get off shift, get some rest before we then move into some more technical training, and really work with leadership to get them to buy in on that and prioritize this. So I think sleep culture for a department is really, really important, because inevitably, whether it's not always leadership making the wrong choices. I think it's easy to blame leadership when leadership is doing the best they can with oftentimes very complex, challenges and trying to find the best fit.
Competing priorities.
Yeah. but also as we watch each other as teammates, right? You're going to see your teammate making choices that may or may really not be in their interest. And to be able to put your hand on their shoulder and say, hey, brother, hey, sister, I love you. And what I see you doing here is not going to work out well for you. And it's not going to work out well for us. I recommend you turn the Xbox off now.
Yeah.
Right.
Or go take a nap or something.
Right. Yeah. Especially after a long shift that may have kept you up and there was no sleep opportunity. And, look, if it was a busy shift that didn't last, it was so busy, you got zero sleep. People want to get out the door. I don't want to, clock out and get gone, right, is a really strong urge. But watch folks, and maybe offer them, that little bit of advice like, hey, I think it's time to get some rest before you get in the car, right? I think you need to slow down. Because, if you've been up for that extended period of time, it's like driving drunk, right? It's operating as though you're intoxicated, right? So I think the same thing coming home from a bar. Would you let a friend drive home drunk from the bar, or would you grab their keys?
Yeah.
Right.
Same kind of thing.
And
that's, I think that does speak well to the cultural thing and also the cognitive performance thing, which is big.
Yeah. And I think one of the other things, and this may be something else altogether, but, when people are having trouble falling asleep, there are some distinct things they can do to work to their advantage, right? When we think about our nervous system, our autonomic nervous system, there are kind of two sides to that. There's the sympathetic nervous system, which is our fight or flight response, which is highly activated at work, for public safety professionals. But then there's also the parasympathetic nervous system, which is what allows us to quiet down and calm down. And this is what we need to do to get into that sleep cycle, right? We need to activate our parasympathetic nervous system. One of the real important ways that you can do that is through breath work. Right. So I would encourage anybody who's listening to this to go watch a video that talks about box breathing or autonomic regulation through breath work, and learn how to use your lungs as a tool to shift your nervous system into parasympathetic mode so that you can actually fall asleep. Right. Start thinking about other exercises you can do, like yoga, for example. Right. Who needs yoga more than anybody? Guys over the age of 40.
Me.
Yeah, right. We start to get stiff, and yet we're much more likely to see us in the gym lifting weights. When the truth is, no, we need flexibility, right, as much as anything at this point, and that's going to help us also fall asleep. One of the other things I think that happens, for folks like you who are out there protecting us, is you sometimes see humanity at its worst, and as you do that over time, it can drive you into a place of deep cynicism for folks, where you start to anticipate and see the worst in people. That's a mindset which may be useful in some ways on the job, but it's not something that you probably want to carry with you day in, day out. It can really mess up your ability to have other relationships with good people in your lives.
Absolutely.
Yeah. And so there's another video I would recommend to anybody online who listens to this. And if you just get on YouTube and look up Brian Sexton, 3 Good Things as an exercise, it's really, I won't go through the details here, but it's a phenomenal tool that you can use before you go to bed to change your brain into something that, instead of only storing all the negative memories, also starts to selectively store more positive memories. Right. And then this forms kind of the default mode, sets the context for how your brain is perceiving and adapting to situations, which is not always entirely based on the negative. Right. It's a gratitude exercise that's phenomenal. So 3 Good Things, Brian Sexton. We did this for my staff. We had a contest to see who could do it the most days in a row. And you could actually see the culture of the office start to change when people started to actually do this exercise. It's very straightforward. It's very simple. And yet, when they looked at it from a scientific standpoint, it was found to be as effective as antidepressant medication for mild to moderate depressive symptoms.
Wow.
And it's just a simple exercise.
I'll have to check that out myself.
Yeah.
I want to make sure I don't miss a question about fragmented sleep as it relates to the human performance stuff at large, which is drink more water, drink more water, drink more water. And the problem with drinking like 9 gallons of water a day, and I consume a lot of water on any given day, but inevitably that means I have to get up to pee.
Yeah.
where's the balance there? And how do I find like the right amount?
Yeah, it depends, right? Like,
weird.
Yeah, right. So if you're out there, doing a lot of hard physical work, here in Arizona, it's very dry. You're going to have to consume a ton of water, right? And it would be kind of irresponsible for me to tell somebody who's out there operating physically in Arizona to drink less water. It doesn't make a whole lot of sense. It really depends on if you are, what happens when you get up to pee. Once you get up to pee, can you go back to sleep? Can you go back to sleep within 10 minutes? That's fine. If you get up once, maybe twice, and you're going right back to sleep, I'm not super concerned about that. But if you're waking up to pee and then you can't fall back to sleep, that's where we really want to start to look at it and figure out, well, what else might be going on and how do we start to adapt that? Some of the relaxation exercises are going to be critically important. The breath work, doing some yoga, listen to, podcast or an audiobook. There's a lot of different things you could use there to fall back asleep. Also, when we look at light exposure and sleep fragmentation, I just read a study last week that said actually the morning light was not really found to be super effective for fragmentation, but mid-afternoon light actually was more helpful. So again, it really is kind of a nuanced thing. I think it's an evolving science. What we think we know, well, half of that's going to be found to be dead wrong in 20 years.
Challenged and researched.
Yeah. It makes it really hard to do podcasts because, whatever we say on the podcast.
Sometimes they don't age well.
Yeah, exactly. Yeah.
What would you say to a guy, let's say a public safety person who is working graveyard shift all night or a 24-hour shift? They're up all night and, they're like, Doc, I know I got to get sleep, but like the kids got soccer in the morning. Like they got to get to school. I got to do this. I got to do that. Like I just have I got house chores. I got to go back to work the next night. What would you tell them about how they prioritize sleep as far as the cultural side of it goes?
I think that's a realistic scenario. For those of us who are old enough to have families and to try to balance those, work and family priority, there's no easy answer. I think a lot of that comes down to communication. Number one, right? Whether you're communicating with your family, hey, this is my shift right now, and I know I need to be on the hook to do this, but is there a way that we can balance this out to where I can get an hour of sleep? Can I do something so that I'm not operating completely without sleep? I know for police officers, it's probably hard to sleep at work, right? Tell your boss, hey, I want to sleep in. It's not like a firehouse, right? Where there's actually like a bed right there for you. Sadly. Is there? Yeah. Right. But to talk about that with your work too, and to say, hey, these are my family needs right now. I may or may not be able to switch off graveyards just yet, but I want to let you know how graveyards is affecting my family so that when the opportunity comes, there might be an opportunity for me to rotate sooner, right? And I think communication about needs is really important, and negotiating that with the people around you so that you manage expectations, right? But then when you do, get home, I think, for kids scenario, it's really challenging, but try to find those opportunities, right? If the kid is little and it's time for naps, take a nap too, right? Use that downtime. And I think you're just looking for the opportunities and not ignoring the opportunities that come up for you. I'll tell you, when it comes time for bedtime, for example, one of the great tools that I like to talk to people about is, instead of doing story time, right? We all love story time, and that's a really magical time for us with our young children. Take that time to put on an audiobook or put on a podcast, turn all the lights down low, right? Where they're falling asleep listening to a story, you're also on the glide slope now to falling asleep. It's that same sort of thing. And people like to have some distraction. I need to turn my brain off after a busy shift. Start thinking about using audio as a tool to do that instead of video. You're not going to be getting the light exposure from that. Great audiobooks are out there and podcasts. I'll plug your local public library. I think, do you have a library card still?
I do. I don't know where it is, but I have one.
But right, so this is a huge thing. So I went to my local public library in San Diego, and I talked to the librarian, and they told me about the Libby app. Have you seen this thing?
If it's audiobook servicing, I think so.
Yeah, it's free audiobooks from your public library, and it's right there. It's super cool, and it's free. And, I know libraries are going to need, more people with library cards to demonstrate their relevance too. So it's sort of a win-win, societal gain. So, I think all of these things, kind of a roundabout way to talking about sleep, but this is an opportunity for you to try to get sleep, to wind down and find those ways to put yourself back on target. But it takes a little bit of creativity.
Yeah. And I think the conversation that came up in the class when this happened, and I don't know if you remember, it was vivid to me, but you're obviously going around the country doing these all the time, and this was the only one I've been to. The conversation with this particular guy that asked the question, he talked about, I got my kids, I got this and that, and part of that conversation was like, this is really about, again, from a cultural standpoint, like making this a priority, making sleep a priority. And one of the discussion points was like, well, knowing everything you know now, is making it to every soccer game really the priority, right? Or is there a time and place to be like, hey guys, I got to skip this one?
Yeah. Yeah. And I think, right. And if you're communicating that and you talk about the need of your family, like, look, I just went to this training. I know that lack of sleep is likely to have a bad impact on my health. When you start talking about this at the beginning of the season, you don't wait until that day of the soccer game. Right. You set the expectation up front to say, I don't know if I'm going to make it to every game. I want to make it to as many as I can, and I want to make it to as many as important to you. So how do you think we can do this in a way that allows me to maybe get some sleep when I need it? Can I tap out every once in a while?
Or can you make it up somewhere else in the day? Like, hey, maybe you handle lunch and stuff, maybe your partner handles lunch or whatever while you take a nap after the game or something like that.
I think there's always, exactly. This is that knowledge versus wisdom. It's very, your own specific situation is where you're going to have to apply this stuff. And it's very hard to give broad advice about people's lives that are so unique and so different.
And one of the key things I think that you said as far as implementing that is you're not just letting other things come up. You're looking for the opportunities. It's not a passive thing, right? You're actively looking for an opportunity to like, all right, this is my chance to get more sleep. I can go to bed early tonight, or I can fit a nap in or something like that, and make it a priority.
Yeah.
A couple quick things I want to hit just before we run out of time, because I know we got to wrap up soon. Jet lag, or dealing with time differences, or a scenario where I've got to try to either force myself to sleep or just stay up. Like, is there a point at which I should just suck it up and power through it versus try to get that nap in?
Yeah, I think jet lag. So on your next trip to Europe, it'll come in handy, right? So if you're flying to Europe, you might be like 9-10 hours ahead. What's really useful, and this is what sports teams do, is they start to sometimes program that in ahead of the travel. Right. I think there's a great app out there called Jet Lag Rooster, or a website that you can look at that you can say, here's where I am, here's where I'm going. And it'll actually give you a kind of a sleep protocol that'll let you start making those adjustments before you make that travel. So you pivot. If you know you got to make up 10 hours of difference, why don't you see if you can do the 2-hour adjustment before you go? Now you're only adjusting 8 hours once you get there. Right. The key is that you want to get on a regular sleep cycle at the right circadian time as soon as possible. So is fatigue your friend or fatigue your enemy at that point?
I would say it's your friend when you need to get to sleep.
Exactly.
But obviously getting there that's the hard part, right? It's like managing the fatigue, powering through up until that point might be the sticking point.
Yeah, exactly. And so, if you're going to some foreign country and you've been on a long flight and you haven't slept in 36 hours, should you jump in your rental car and start driving through Paris? Probably not, right? Maybe it's time to not do that choice. Maybe it's time to, catch the metro and get on the underground and go to your hotel, come back and get a rental car later or something. But if you can get some sleep on the flight, obviously that's important. And what you really want to do is try to get to sleep at the local time as soon as possible. And so if you find that you're taking, a long nap and then it disrupts your ability to get on the local time, then that probably wasn't such a good idea, right? The goal is to get on the local time as quickly as possible, and fatigue might be your friend there. Right.
So a little short-term trade-off might be worthwhile in terms of suck it up, power through, get to that normalcy, whatever that is for where you're at. Related to that, What if I'm flipping back and forth from days to nights? Like tonight I got to work a night shift, but tomorrow I got to be up in the morning, or vice versa.
Yeah, that's almost impossible to physiologically manage. You're going to use a lot of naps, right, as much as you can. And I think the devil's in the details, though, where we'd really want to kind of lay this out on paper and look at it together and figure out where are the sleep opportunities. Can I get some sleep in there as much as I can, and plot that out where you can visibly see it, maybe schedule it on your calendar so that it's a known kind of appointment almost. But in addition to that, you're probably going to be using a lot of naps, and you're going to try to not switch back and forth as much as you can, right? At that point, we're doing fatigue management operations much more than building good circadian patterns. If life is inconsistent, it's very hard to make sleep consistent.
Is it a good idea if I work a night shift during the week to maintain that night shift on my weekends? Let's say I work 4 days in a row, I have 3 days off. Is keeping that pattern better or worse than trying to flip back to days?
Yeah. How long are you going to be doing that? Is that like for a month that you're going to be on nights, or for a career?
Let's just say perpetually. Yeah.
Perpetually. So I think that's the bigger, I'm kind of answering a different question, right? Which is, I don't think you would want to really be perpetually on a 4 nights a week schedule, right? You'd really want to try to find a way to do that maybe for a few months and then try to shift yourself back onto a normal schedule. What they've shown with long-term night workers is cognitively speaking, when they let them get back into days, even if they're well adjusted to night work, they still perform cognitively better when they're working on a daytime circadian rhythm. For me, if I was working for a period of a month on working 4 nights a week and then 3 days off, I don't think there's an easy answer there. I'd be trying to get the sleep. I'd probably maintain the consistency for that period of time. Right. If I find that if I find that I am able to get to sleep, right, I've got myself on a new rhythm, and once I get in bed, I've got blackout curtains. It is cool, dark, and quiet in my room. Once I get in there, I actually fall asleep. I stay asleep pretty well. I would try to perpetuate that through, but I would not do that over
long term.
Not long term.
Yeah.
Right. Exactly. Yeah. And then you also got to think about how much of that is allowable given the context of your life and the soccer games and the, grocery trips and the rest of it that we also have to do. So,
yeah. And then we're back to the cultural thing.
Yeah.
It's a challenge for sure. All right. Well, if you had to sort of summarize some of this, what's the elevator pitch? If you had just a short period of time that you're trying to, like, through a fire hose, give someone your most compelling case for making sleep a priority, what would be your bullet points?
Yeah. No, I think that's great. I think number one is just to realize that everybody needs to sleep. This is our number one recovery tool. We're not going to recover if we're not sleeping. It's our maintenance cycle, and it has to be prioritized. Nobody's going to prioritize it for you. As much as we want to wait for those circumstances to be right, we have to do that for ourselves sometimes. There are life circumstances that get in the way, right? There are controllables and there are uncontrollables. Manage the controllables, figure out what they are, be proactive, plan ahead for those things, and use the tools that are at your disposal to try to increase your chances for success to get good sleep. As far as, lifestyle modifications, I really, really want people to lean into circadian entrainment as much as they can to try to get light when it's supposed to be light, to get dark when it's supposed to be dark. That's going to make everything else work better, right? If you're trying to take medications to help you with sleep, but not doing any sort of circadian entrainment, you're really fighting an uphill battle. I also think fatigue management is critically important, to realize that we are all going to be tired at some point, and to be thoughtful and safe about that. Use naps. Don't miss opportunities for sleep if you're fatigued. There is no medication that replaces sleep, right? There's no amount of caffeine you can take that makes you not need to sleep, right? So use the fatigue management tools that you can, those being naps, caffeine, strategically, tactically, and light exposure. But doing these things in a way which is helping to create kind of this rhythm to it. And then, I think the other thing is, don't be afraid to ask for help, right? There are all sorts of problems that you're not going to fix on your own. Sleep apnea is another one that we haven't talked about. You're not going to fix sleep apnea on your own. And we see that so commonly. See a doctor. Don't ignore that, right? The long-term effects of being hypoxic all night long are terrible for your brain, terrible for your health. So if you're noticing you're gasping, you're snoring, even frequent peeing at night can be a sign of sleep apnea. But if you're concerned about that, go see a doc, get tested. If they offer you treatment, take the treatment. People they're prescribed CPAP. That's the gold standard for treatment of sleep apnea. Some people don't tolerate it really well, but they can go back, they can try different masks, different devices to make it work. But if they really can't make that work, there are also sleep dentists out there who can design orthotics that might help to keep that airway open. We know from BLS class, just a simple jaw thrust maneuver, right, helps to maintain an airway. And so prioritize it, control the controllables, and don't ignore problems. If you feel like you need help, get help.
Yeah, and I want to that's a good point to close on, which is obviously we can't give you medical advice in a podcast, so that's not what this is. These are just some thoughts and tips and tricks, but also the things that Doc said earlier about, there are a lot of other underlying medical things that could be at play that you need to consider too. That things like getting labs tested and all of that are, have their place. So take everything we say here with a grain of salt as far as that goes. Is there anything else that anything else you're working on that you want to talk about, or resources or anything you'd like to point people towards?
Yeah, I mean, there's a ton of stuff out there on the internet, so much more so now than there was 6 or 7 years ago when we started this. So I think if people are being proactive and looking for solutions, they will find them. For me, the things I'm working on right now are really trying to set up a practice outside of the military now that I've retired after 25 years in the Navy. So
thank you for your service.
Hey, my pleasure. And thanks for your trust, and thanks for your service. Trying to set up a practice in San Diego, trying to explore as much as I can about, civilian healthcare practices. And then how do we work within a system of care that's very cost constrained to get people the highest level of care that we can possibly get for them, and really work within a community to build better mental health within my community. That's critically important to me, to try to pay it forward. And honestly, the opportunity to work with public safety professionals like yourself is how I feel for myself that I'm contributing to the good for our whole community. So thank you for letting me be a part of this, and thanks for everything you do.
Absolutely. It's my pleasure. And as far as the class that you've done, I mentioned this to you when we met up this morning. It was transformative for me in a lot of ways. And one of the O2X isms that I stole and took back to my team is just try to get 1% better, and make 1% changes, and those things will stack up and aggregate, right? So, take one little thing out of this, hopefully, and get better sleep, and work towards that wellness, avoid some of the illness, hopefully. But if you are ill, then take care of those things. But really that class, your class specifically, helped me a lot, and it's definitely helping guys at my team. We've been incorporating this into training pretty regularly and made some significant changes on the scheduling front, for example, and how we plan our training days around making sure guys can get enough sleep. So thanks for everything you've done, and thanks for joining us on the show.
Cool. Thanks, Mike. Catch you later.
All right. All right, guys, that's all we got for tonight. This episode is brought to you by Drip Drop. Drip Drop Oral Rehydration Solution is an electrolyte powder that you mix with water. It was formulated by a doctor for quick absorption. I work in the desert, and it only takes a few hours in the heat, wearing body armor, carrying around a bunch of gear before I start feeling like crap and fall behind the curve in dehydration. Drip Drop keeps you in the fight so you can finish the mission and rehab for the next one. Go get you some at dripdrop.com or on Amazon, or ask your supply guy to find it for you. Don't forget that we put out new episodes on the 1st and the 15th of every month. If you like what we're doing, you can head over to Patreon, give us $1 for each new episode. That money's going to go back into bringing you good content. If you want to interact with us, you could find us on Facebook, Instagram, and Twitter. We are at TacTangents. You can also email info@tacticaltangents.com. And one last thing, our Facebook discussion group. We've got a little group going on Facebook. If you go to the groups tab on our page, you can join it. We've got more followers on our page than we have in the group. So I know there's some of you out there following the Facebook page that are on Facebook that are not in the group. Lots of like-minded people in there. So come hang out with us. All right. That's all we got. Good talk.